The first 4 months of Ozempic are well documented: rapid weight loss and persistent nausea. But we are only now beginning to see what happens to the human body after 4 continuous years on the drug. For long-term users, the anxieties are specific. Does staying on this medication lead to thyroid tumors or chronic pancreatitis? And how much of that weight loss is actually a permanent trade-off for lost muscle? We no longer have to guess. Multi-year clinical datasets, including the SELECT trial and the FLOW kidney study, now provide a clear map of the biological changes that occur over a 4-year horizon. This timeline reveals that Ozempic is a more complex biological intervention than the temporary cosmetic hack often seen in popular culture. During the first year, the drug mimics the hormone GLP-1. It binds to receptors on the pancreas to stimulate insulin and suppress glucagon, while simultaneously forcing the stomach to slow its digestive pace. This delay in gastric emptying creates a physical bottleneck. Because food remains in the stomach significantly longer, users often experience waves of nausea and vomiting as the body adjusts to the slower processing speed. This chart shows the average weight loss trajectory during that first year. The reduction is steep and consistent, typically reaching a maximum of 15% of total body weight by week 65. However, a closer look at that total weight loss reveals a hidden toll. Up to 40% of the mass lost in that first year can be lean muscle rather than fat. This level of muscle loss increases the risk of functional decline as users age. To maintain strength, clinical evidence suggests that high protein intake and resistance training must be a mandatory part of the protocol. In years 2 and 3, visible weight loss levels out at a durable 10% reduction. However, at the same point, the clinical focus moves toward internal, systemic protections. The SELECT trial followed over 17,000 adults and found that long-term use resulted in a 20% reduction in major cardiovascular events, including heart attacks and strokes. There is a specific detail in the timeline. Those cardiovascular benefits appeared in the data well before the patients reached their maximum weight loss. This suggests the drug reduces vascular inflammation directly, independent of calorie restriction. The protection extends to the kidneys. In the FLOW trial, researchers observed a 24% drop in major kidney disease events, a result so significant the study was ended early. These outcomes from year 3 suggest the medication's role extends beyond weight management, acting as a preventative tool for the heart and renal systems. By year 4, we can accurately audit the accumulated biological risks, starting with the most prominent internet fear: thyroid cancer. While the FDA maintains a boxed warning for thyroid C-cell tumors, that signal was based on rodent data. In a study of over 400,000 human patients, the actual rate of thyroid cancer showed no increase compared to other treatments. While the cancer signal has not translated to humans, the data does confirm a rare but validated risk within the pancreas. Constant GLP-1 stimulation can overwork pancreatic tissue. In 0.2% of users, the organ overproduces digestive enzymes until it becomes inflamed, potentially leaking those enzymes into the surrounding tissue. Gallbladder complications represent the second validated risk, caused by the combination of slowed organ contractility and the metabolic stress of rapid weight loss. Successfully navigating the 4-year mark requires monitoring for these specific gastrointestinal and pancreatic symptoms, rather than focusing on debunked cancer fears. This leads to the most important question for long-term health. What happens to the body if you stop the medication after 4 years? The withdrawal data is stark. When dosage drops to 0, patients regain 2/3 of lost weight within a year, while blood pressure and metabolic markers slide back. This isn't permanent damage. Data shows wines returning to pre-treatment baselines. It's simply obesity reasserting itself. Effective long-term use requires treating obesity as a chronic condition rather than a temporary hurdle. In practice, this means viewing the medication the same way a doctor views a statin or a blood pressure pill, as a continuous baseline intervention. Thriving on a 4-year timeline requires a chronic care strategy, including annual labs and muscle preservation. The drug is most effective when treated as a permanent lifestyle partner rather than a temporary fix.